Imagine you're at the end of your life and you're confined to your bed. You have to take medicine every few hours to keep the pain at ease. You're miserable. Would you want to be relieved of the misery and have the choice to die? I know I would. According to an article in the New World Encyclopedia by Funk and Wagnalls, euthanasia is the practice of intentionally and directly ending the life of a person who has a severe and incurable disease. Euthanasia can be broken down into two categories: active and passive euthanasia. Active euthanasia involves deliberate actions by a physician who administers a lethal dose of a drug to end a person's life. Passive euthanasia can be described as ending life-sustaining treatment. As humans, we have the right to euthanasia. We also have a moral obligation to allow those who are in pain and suffering to choose to die. If someone is in pain and suffering, why should they have to continue living this way? People should have the right to die when they want to and how they want to. We all have the freedom of choice. We have a moral responsibility to allow those who are in pain and suffering to have the option to choose between life and death. We have the right to autonomy and making personal decisions about our health care and the treatment we receive, which means that we can refuse treatment and choose euthanasia. People should have the right to die when they want to and how they want to. As Americans, we all have the freedom of choice. What does it mean to have the right to die? According to Meisel, Sermonara, and Pope, when referring to the right to die, people mean they should have the right to refuse medical treatment. We all should have the right to refuse medical treatment for our own bodies. If this is what someone wants for their own life, it should be an option that they have. Out of the New American Standard Bible, Ecclesiastes chapter 3, verse 1-3 says, "For everything there is a season and a time for every matter under heaven, a time to be born and a time to die, a time to plant and a time to pluck up what has been planted, a time to kill and a time to heal, a time to break down and a time to build up." There is a time for all of us to die, and I believe that our time to die can be altered by euthanasia. As Americans, we have many rights, and I believe that one of those rights is the right to die. As long as the patient is conscious and making the decision with a sound mind, they should be able to choose to die. Dying is not always a bad thing, especially if it is someone's choice for their own life. What does it mean to have the freedom of choice? The Business Dictionary describes having the freedom of choice as the right to exercise one's freedoms in any manner one may choose, except where such act may obstruct or prevent others from exercising their freedoms, put oneself or others in danger, or exceeds a statutory limit. Not allowing someone the option of euthanasia is obstructing their freedom of choice. Is it morally appropriate to allow those who are in pain and suffering to continue to live this way, or should we be merciful and help them out of their misery? I believe that we have a moral responsibility to be merciful and to allow those who are in pain and suffering to choose to end their life or live in misery. In Margaret Batten's article, The Case for Euthanasia, she talks about the principle of mercy. The principle of mercy states, where possible, one ought to relieve the pain and suffering of another person when it does not contravene that person's wishes, where one can do so without undue cost to oneself, where one will not violate other moral obligations, where the pain or suffering itself is not necessary for the sufferer's attainment of some overriding good, and where the pain or suffering can be relieved without precluding the sufferer's attainment of some overriding good. People who are in pain and suffering should be relieved at the mercy of others, physicians or family, if it is their wish. We should not force them to live a lifestyle that is miserable and unwanted. For physicians, mercy may have a different meaning. Batten states, for a physician or other caregiver to extend mercy to a suffering patient may mean to refrain from procedures that cause further suffering, provided, of course, that the treatment offers the patient no overriding benefits. The meaning of mercy to physicians means that they may stop treatment or giving medication to patients that are suffering to allow them to slowly die. Mercy to the average person may mean that they help relieve the pain and suffering of someone if it is their wish. Batten states that mercy demands that the pain, even if with it life, be brought to an end. This means that they can relieve the pain and suffering of this person in any way the person wishes, even if it means taking their life. Should the government be allowed to dictate someone's decision about life-ending matters? About end-of-life matters. We have the right to autonomy in choosing what treatment, if any at all, we should receive. This also means that we can refuse treatment and choose euthanasia. The principle of autonomy states, one ought to respect a competent person's choices where one can do so without undue cost to oneself, where doing so will not violate other moral obligations, and where these choices do not threaten harm to other persons or parties. As long as someone is competent and knows that euthanasia is what they want for their life, we should respect their choice and grant them their wish of euthanasia. Batten talks about the plea of euthanasia and states that it is no doubt true that many requests to die are pleas for better care or improved conditions of life, but this still does not establish that all euthanasia requests should be ignored, because the principle of paternalism licenses intervention in a person's choices just for his or her own good. Not everyone that requests euthanasia should be ignored. Some people believe this is the best option for them considering the situation they are in. If someone is in their right mind and are suffering at the end of their life or terminally ill, there are reasons why they would request euthanasia. Why do some people believe that euthanasia should remain an unacceptable option for those who are considering it? Not everyone agrees with the statement that euthanasia should be legalized. In fact, many people believe that it should stay illegal and that it is morally wrong to participate in euthanasia. Casimir Yale, a law professor at the University of Michigan, believes that patients may feel obligated to end their lives due to financial difficulties or to relieve the emotional strain of a loved one. He also believes that if euthanasia became legalized, eventually it would get out of hand and be offered to anyone that wanted it. Gay Williams argues that euthanasia violates our natural inclination to continue living and precludes the possibility of a miraculous recovery or that a new cure may be found. In addition, he states that euthanasia violates the medical professional's commitment to save lives. Some people believe that if physicians participate in euthanasia, they are backing out on their commitment to save lives. I believe that if physicians participate in euthanasia, they are giving their patients what they desire and are also relieving people's pain and suffering, just in a different way. Euthanasia should be legalized because we have a moral responsibility to allow those who are in pain and suffering to have the option to choose between life and death. We also have the right to die and the freedom of choice. Patients who want to participate in euthanasia should be allowed to do so.